Hello, today we are discussing at Dewan Hospital the important aspects of surgical practice during this period of Corona COVID 19 pandemic, in which 40 lakh people have died worldwide due to coronavirus infection and are still dying. So, number one, what are the surgeries which must be done during this COVID period? Now, during general surgery, the common surgeries which are sort of an emergencies, if we don't do those surgeries, then the patient likely to get deterioration in the general condition and may even die. Those must be done. That patient may be suffering from coronavirus disease or may not be suffering from coronavirus disease. They are a necessity. Now, what are those necessity surgeries? For example, gallstone problem. In the gallbladder, there are stones. This is a very common surgery which is performed, the commonest surgery which is performed at Dewan Hospital. Now, in this surgery, you see, one type of thing is that the gallbladder has a stone inside. The gallbladder it has a stone inside, but this patient does not have any problem whatsoever. So if a gallbladder does not have a stone inside but has problem, but it has a stone inside but does not have a problem at all. So that surgery, as usual, can be postponed. You have a gallbladder with stone, but you have no nausea, anorexia, vomiting, burping, passing too much of flatus, diarrhea, or constipation, pain abdomen, jaundice, fever. So any such problem, you don't get operated for the time being. But the question is, if you have problem due to gallstone which you are having, that is again the same thing. You have significant pain, vomiting, fever, or jaundice, or diarrhea, or too much heaviness. You are not able to eat. So such problems you have to have surgery. But in that surgery, again, now we have to check you up. If you find fit after checkup, then we have to, because we give general anesthesia to you. If by chance the COVID is already started and the patient have some chest infection, but which is not evident on the clinical examination, but later on may become a serious problem. So we have to do RT-PCR test, take a chest X-ray to see at the diet time the patient is not suffering from COVID-19 or coronavirus disease. Now, these tests are absolutely necessary. If somebody is operated without these tests and suffering from the chest infection due to COVID, the problem is likely to increase, and the chances of increased risk and even death are more. So with precautions, a patient who has gallstones in the gallbladder, cholelithiasis, must get the surgery, but with proper investigation and due care. Second thing, if a patient has gallbladder but doesn't have a stone, but has got swelling of the gallbladder, now this problem earlier used to also be there due to say typhoid or tuberculosis. And there are no stones, but gallbladder is inflamed, is red, patient is having pain, fever, vomiting, but there are no stones in the gallbladder. So the patient earlier had to be operated because there is a high risk of perforation. Now, what has been found and documented throughout the world, and many papers have come out from various parts of the countries of Europe and even China, that gallbladder alone, without cough and fever and uh, breath problem, can be inflamed not by typhoid, not by tuberculosis, but by coronavirus, COVID 19, COVID 2 virus infection. It has been proved. Now, the question is, some cases which I have studied, I have done a literature research on this. So that is that one patient was operated with at some place in the Europe, and they operated upon that patient with gallbladder infection without stone. And later on, patient developed the symptoms in the chest and pneumonia. He died. So the question is that should not have operated upon. Whereas a patient who became serious, they thought, okay, we'll wait. And the patient became serious. So they operated. And in the gallbladder they removed, they found that the veins of that gallbladder were clogged with the clots of blood. Blood has solidified in those veins. So as you know that anticoagulants means the thinner blood thinners are routinely given in COVID infection because due to certain biochemical methods and pathogenesis. It causes coagulation of blood in the pulmonary veins, due to which the patient is not able to breathe, and the right side of the heart that swells up, and the patient dies many times just due to the pulmonary vein thrombosis, or even the thrombosis of other veins in the body. Similarly, in that gallbladder, the veins were thrombosed and the gallbladder had become gangrene. So it was good that they removed. Even the patient was suffering from the COVID. So this is the thing, that if you have symptoms with stone or without stone, you must consult a doctor. You must get proper investigation, and you should be admitted. If the surgery has not to be done, even then you should be admitted, and you should be put under regular observation, investigation. In case the surgery becomes necessary, the gallbladder is likely to rot up, which is called gangrene, or perforate, then it's a very risky game. It becomes serious. So you need operation. Similarly, appendicitis is an emergency. Now, appendicitis means the appendix infection. This is again of two types. In the appendix, sometimes called a ficcolith, means the stools which solidified, they block the inside tunnel type thing. It is the lumen inside portion of the appendix. So the secretions of the appendix cannot go back. So appendix swells up. The secretions, they collect bacteria, and the pus forms there, and they will burst. Also, the artery supply to the appendix that lies on the appendix itself, that become thrombosed due to swelling of the appendix and inflammation of appendix, and then the blood doesn't flow. It is likely to become gangrenous and burst. So this is one condition. So if there is stone and the appendix is swollen, then we need surgery definitely. But if the appendix is not having any obstruction by ficcolith or any other stone or something which we have eaten, so it is inflamed, it is not perforated, then in case that appendix can be usually due to other bacteria, but can also be due to corona infection, COVID-19 infection. Now, in that case, tests we must do, COVID tests we must do. But in that case, even due to COVID infection or without COVID infection, without obstruction, we should give antibiotics, IV fluids, and keep the patient under observation. So about 50% of the appendices can be settled like that, and the surgery can be postponed if the appendix has not already perforated, not become gangrenous, or severely swollen. So this is about two surgeries. Similarly, in all other surgeries, you have to weigh the risk and the benefit, like we always weigh. And only the surgeries which can be postponed should be postponed. But those surgeries which are risky to postpone must be operated. Now, we had a case of appendicitis which has come from outside our city, and that case was not having any obstruction in the appendix. And I saw that case, we admitted that case, and we sent for RT-PCR because we were planning to operate. RT-PCR became normal, and the pain, etc., here and fever became less. And because in the beginning also, when I pressed the abdomen, so the appendix, there was not much of pain there. So this was that it got settled, and we patient needed the treatment for COVID, so we referred the patient to a COVID hospital, and patient became all right after some time. So this we have to be take care. But the other things are that COVID infection can also cause infection in our salivary glands, and so our saliva, that is watering in the mouth, which helps us in chewing, in digestion, in keeping our mouth wet, so and teeth healthy. So that saliva may contain COVID, virus. So if we drink something, we should not share it in routine. Not only the question of keeping distance, wearing a mask, and washing the hands and sanitizing them again and again. So even we should not drink or eat something which is eaten by someone else, because the person may be at that time secreting COVID viruses in the secretion. Then this can be swallowed inside, and inside this swallowed can go to from here, like I'll show you, it can go inside into a stomach. But stomach has acid. Acid may neutralize it or may not neutralize. This is all the subject of investigation, because COVID infection and coronavirus infection is a new thing which is not being able to, we are not even worldwide to completely manage it. That's why so many, about 40 lakh deaths have taken place already, more than that, worldwide, and in the richest and most powerful countries of the world. So this but gastritis due to COVID infection and the COVID virus attaching itself to the walls of the stomach and causing severe vomiting. And of course, vomiting means some pain abdomen will be there. So it will be presenting like a surgical emergency or a medical emergency also. So we need to take care that this can be due to COVID infection. Similarly, I already talked of appendix, already talked of gallbladder. This colon and small intestine also patient can present with diarrhea. So most of these diarrheas are not watery diarrheas like cholera infection or some bacterial bacillary diarrhea or viral other diarrhea. They pass 4 and 5 stools with some pain abdomen, and it continues for 4 5 days or 10 days. So all diarrheas of such type we need to investigate and for the come to know that this can be due to coronavirus infection and COVID infection. This should be must be considered. So these patients need to be investigated properly and treated properly. This is the responsibility for the patient to understand, because patient is the one who will choose the doctor and the hospital, and the doctors to understand that this can be also possibilities in corona pandemic period, because so far no proper vaccination has been found that will give you 100% protection against the COVID-19 disease. Now, the what surgeries we have discussed that must be done and should not be done. Now, what are the precautions for the patients who come to the hospital, which they must take for the thing that they should not bring COVID infection to the hospital and should not take the COVID infection from the hospital back to their nears and dear ones. Similarly, it applies to me that I should not take the COVID infection back from my this hospital back to my children and my friends anywhere. And so this is two-way affair. They should not bring infection here and they should not take away infection there. So I would like to ask my staff what should be the steps that should be taken, that the patients should be identified that they may be suffering from COVID infection. Darshana, what can be the symptoms that we should have to be careful? The patient comes to our hospital. I mean, cough. Hmm? Patient, if he has cough, what else? Cough, fever, respiratory problem, tiredness. Hmm? Anything else? Hmm? Pain. Yeah, chest pain, headache, earache, and now diarrhea also. So yesterday only we had a patient who had come for the gallstone operation, and so I went outside, and they had long-standing gallstones, and they had vomiting from many years, and they had come for pain. But I observed that the patient is slightly dyspneic. So I asked patient, "Do you have coughs?" He said, "Yes." From 4 5 days. Do you have sputum? Yes. 4 5 days white sputum. How much? About 5 6 teaspoonful, tablespoonful maybe. That's spoonfuls. So then I said, "You have fever?" Yes, they have fever. So you have. I said, "Do you have vomiting?" Yes, they have vomiting. Now all these symptoms can be caused. I said, "Have you got your thing you self-examined from a doctor?" No. Have you got your RT-PCR test done? No. Okay, get it done. RT-PCR. No, we will not get it done. So if you have fever as such and cough, I cannot operate anyway, right? Even gallbladder stone is an elective surgery when they have from 10 years. But gallstone, which has pain, which has causing jaundice, which has caused pancreatitis, which is the gallbladder is getting rotten or got perforated, or severe symptom, patient cannot sleep, patient cannot work, patient cannot eat. That we have to operate, but we have to take due precaution. So the patients who have fever, who have cough, who have lot of sneezing, who have sputum, they should, if they don't have some symptoms which are pressing symptoms that they surgery requiring, they should not come to the hospital for surgical cure. Uh, they should go to the hospital, which is COVID in ward. which is using the treating the COVID patient. Now, if they come to the hospital, what precautions we are like some patients will see anywhere this is on the YouTube a video going. So some patients anywhere the people who are watching, if they have to go to hospital to protect the other patients in the hospital, relatives of the patient, the staff there, what things they should do before entering the hospital or after entering the hospital. Yes.
So sometimes some people
Okay.
sometimes some people do not take any precautions like hand washing, uh, wearing mask. So please request to all people always wearing mask and hand sanitize again and again.
Yes. And you said that they don't wear the mask properly. How do they wear the mask? They must wear up to the nose. But usually you find the patients, they wear up to what? They don't include the nose. And when you tell them wear properly, they start fighting with you. Huh? Yes. So they should not fight with the staff. The staff guides them that wear the mask properly. Like this is a mask. So there are two ways of wearing it. One is that the thing is worn properly. So they usually come like this. Oh, okay, we want to see the doctor. And they come very close to the staff. And I also go them, I ask them what is the problem. They rush towards me. Whereas they should keep distance, wear the mask properly like this, and they should keep a 6 feet distance. I am not hard of hearing, nobody is hard of hearing here, right? So they should keep talk from a proper distance. And of course, if they have symptoms, they shouldn't come. They should go to a COVID hospital, not to a physician. So this thing, another thing is that they should not bring too many patients with them. Some patients who are admitted, lot of their relatives come, and they all to all enter. And if we stop them, no, you cannot enter. They start argument and fighting. They shouldn't do it. It is for their own benefit, for the benefit of the patient who is admitted, and for the staff and other patients that we are asking them. So they should not come. Only one patient should come. One relative should accompany one patient. One patient is there, so many people try to enter with them. So this is not good. They must understand these are difficult time for the patients, for everybody. And now the question is, if we all take these precautions, the main thing is we have had in India and the world over two waves of pandemic. Now this is that third wave, and the preparation of third wave, government is doing at a very strong way and in a very rapid way. This is what we believe. We believe in our governments throughout the world. Okay, that they will do a good job. Many are democracies, many are dictatorships, many are military dictatorships, and other like in North Korea, and one party rule or multi party rule or democracies, but all governments are governing. So all people have hopes from them, and they are definitely doing. That's what they are doing. They must be doing. But we have to do some things for ourselves. So these precautions, the third wave, you can have, and you can get your treatment, surgical treatment from Diwan Hospital or any other hospital by safety, by your own safety, by keeping yourself safe and keeping the staff and the doctors at Diwan Hospital or any other hospital safe, and your own relatives, your own children. If you are taking these precautions when you are visiting the hospital, it's all right. You are visiting the malls, you are visiting the markets, you are going out. Nobody is, most of the people, very few people are just staying in the home. But they are going outside by taking precautions, like putting a mask and not touching the mask from inside, putting it properly. Hmm? Whenever touch something, keep a sanitizer with you, sanitize your hands, and sanitize, rub it for 30 seconds. Just this much rubbing is not enough. Keep rubbing it for 30 seconds. Watch your watch. Okay? That will be good for you. Okay? So otherwise, wash with the hand or take the things from outside. Even if you have some taken some, strip of a medicine from a chemist, wash it with the soap and water, and then take tablet from it. Right? So we are taking all these precautions. You also take the precaution. Remain safe, and that is what we wish you, that you remain safe and keep your uh, doctors, nurses, other patients, and be considerate to them, and your own relative, your children, your parents, friends, and neighbors safe, and our country safe, because we should not be overloaded again. It's very painful to see people dying outside the hospitals without oxygen, without proper treatment. Because to be very frank, there is no real 100% treatment for COVID. That this medicine you take or this infection you take, you will be all right. Basically, it depends upon your own precautions to avoid the disease and your own ability to fight the disease. In the meantime, if and what the when the third wave will strike, before that, take deep breaths, have good exercise and rest, and take good food. What all you can do to make you strong to fight COVID coronavirus? You, how will you fight the coronavirus?